Welcome back, everyone, or if those of you that are just joining. Again, my name is Tina Costa. I'm one of the directors with the Office of Virtual Health. I continue to be your host for today's virtual sessions. And again, it's my pleasure to welcome and re-welcome those of you to the 2023 BC Digital Health Forum, inspired by Canada Health InfoWays Digital Health Week. For everyone here today joining our virtual circle, we want to encourage a moment for all of us to share in our collective gratitude for the opportunity to come together from many traditional, ancestral, and unceded territories of many BC First Nations. May we take pause to honor their connection to this land and their stewardship in caring for and nurturing these lands for all time. Let us also give thanks for the opportunity to come together today to gather, to learn, to collaborate, and to provide care on these beautiful lands. I now have the pleasure of introducing our next presenters, Dr. Madelaine Gierc and Kiran Kalkat. Dr. Madelaine Gierc is a psychologist and research evaluation lead with Shapedown BC. She holds a Master's of Public Health from the Memorial University of Newfoundland, a PhD in kinesiology from the University of Saskatchewan, and a PhD in clinical psychology from Queen's University. Her research program focuses on behavioral medicine, leveraging social cognitions to increase engagement in health behaviors in order to improve health outcomes. Kiran Kalkat is a registered dietitian with the Shapedown BC program at BC Children's Hospital. Her role with the program has involved working with patients and families, both individually and in the context of the 10-week group program designed to help children, teens, and their families make healthy living changes. Please join me in welcoming Madelaine and Kiran for their talk on version 2.0, from pandemic stopgap to program adoption, development of the Shapedown BC virtual curriculum. Over to the two of you.
Thank you, Tina. I think I'm going to start us off and then just by providing a bit of program background, and then I'll throw it over to Madelaine to take us through more of the virtual curriculum redesign piece. So next slide, Madelaine. Just a bit of background about what we are and what we do. We are the Shapedown BC program, representatives of it. Originally, we started here at BC Children's Hospital in 2006, and we offer what we consider the gold standard of care for pediatric obesity. And we are a program that can only be accessed through physician referral, and our criteria includes both age and growth. So children between the ages of 6 to 17 years of age and BMI above the 97th percentile or above the 85th with comorbidities is what we see. And so comorbidities might mean something like non-alcoholic fatty liver disease, or it could mean anxiety, depression, impaired fasting glucose, that sort of thing. And we are an interdisciplinary team, something we're really proud of. We have physicians, mental health specialists, whether that be psychologists, social workers, or registered clinical counselors, as well as dietitians and activity coaches among our offerings. Next slide, Madelaine. And in 2012, 2013 was when we rolled out actually across the province. So right now, as it stands, we have 6 centers in BC. So we are provincially led, but regionally delivered in 4 health authorities. And this includes another feature of our program that we're really proud of, is that we do have 2 culturally adapted programs that are offered through Fraser Health and Vancouver Coastal Health. So that is our South Asian program, which is delivered in Punjabi, and our Chinese program delivered in Cantonese and Mandarin. And so just to give you a sense, before we dive into the actual meat of our presentation, what our patient journey might typically look like. So starting from that physician referral, we do see all our families through a comprehensive intake assessment. So they would meet with our physician, our mental health specialist, and our dietitian for a sometimes up to 4 hours intake assessment, which is often followed by the feedback appointment, which is a much shorter appointment where we do a little bit of care planning, trying to figure out what were the recommendations from that assessment from the multidisciplinary team, and then what are the goals of the patient or family. And so that leads us to number 5 and 6 there in the diagram, and that's what we'll spend most of today's session talking about. So our group program is one of our main interventions with the majority of our families, and so that was what the virtual curriculum redesign that we're going to be speaking about looked at. So Madelaine, if you go to the next slide, what does that 10-week group program look like, or at least what did it look like before, when we were just offering in-person programming? It is a holistic family-based approach. It focuses not on weight, but rather health and healthy living changes that families can make. So including the child that was referred, as well as anyone else in the family. And it does take a non-diet approach because this is pediatric care. So sometimes families might expect things like meal plans or prescribed diets, and that's not something that we would do. It is very much focusing on the healthy living changes in the realm of nutrition, physical activity or play, screen time, and sleep primarily. And it is a 10-week group program that follows a standardized curriculum, and it is facilitated by a mental health specialist and a dietitian with the support of an activity coach. And so typically what that looks like is 2 sessions a week for the 10 weeks. One is 2 hours in long and tends to be more educational, interactive activities. And then the second session is just an hour long. It is purely physical activity based. Next slide. And just to give everyone a taste of what we're going to be talking about in terms of the curriculum in person, this was what we were trying to cover in our 10-week program. So topics like Canada's Food Guide, balanced meals and snacks, sugary drinks, label reading, as well as parenting, limit setting, emotional eating, self-esteem and body image. And there's just a screen grab of some of our old resources. So we did have print workbooks and healthy living journals where the kids would write down their SMART goals. So this was current state pre-pandemic, before 2020. And so yeah, what we did before was primarily or almost entirely in-person programming. We had some pieces that were electronic or digital. So for example, we had some surveys that families complete before they do the group intervention and then after the intervention is completed. And so that was done electronically. We had some interactive tools that our clinicians across the sites had brought up as like, we should try doing this in our group program. And so for example, Kahoot was something that was being used in the school system that we embraced and started using in our groups, but it was still in person and in real time. And so that was something that we'll come back to as like we really had to lean into when we went virtual with our delivery. And we also had a few, again, one of our teams out in Fraser Health had developed a few recipe videos. And so we had a few multimedia resources, but they were not the majority of our resources. So for example, on the slide there, you can see our recipe videos for muffins and yogurt parfaits. And so then came along March 2020, we had to pivot a little bit. Many of our sites had promised intervention to families, a 10-week group program, either launching in April or May. And of course, there were lots of things to contend with, including practical considerations of the restrictions within the hospitals and the health authorities, immense change that our families and patients were facing, and of course, emerging health challenges around screen time and sedentary behaviors. And so it really did, once we got access to Zoom for Healthcare, really accelerated our ability to deliver a virtual intervention. So we went virtual with our intake assessments, our group delivery, and we really leaned into developing more digital resources and using those interactive tools like Kahoot to facilitate the group and make it interactive while being on Zoom for healthcare. And so this is just an example of like a piece of the group. So in the 10-week sessions, we would usually prepare a snack for the families. So introduce them to a nutritious food. We would do all the prep for them, and it was just served at the end as a teaching moment to highlight, say, a key ingredient or nutrient that we had maybe covered that week. And so, of course, running it virtually, we weren't able to do that. And so we ended up taking our recipes and really producing a lot more recipe videos to make it more accessible for families and easy for them to see what few ingredients that it takes and how it might be something that they could make at home. So like most of the videos are no more than 2 minutes of length. And I think right now we have about 14 videos that I will say pre and post pandemic, we can see the recipes are being used a lot more. And I think it has a large part to do with this. And we did incentivize it a little bit so that if they made the recipe and shared a picture or told us about it in the future group session, they would be entered into a prize draw for a gift card. So that kind of helped. So overall, I would say we can say that the transition of our group program from the in-person version to the virtual platform was successful. We were able to reach families across the province. It was appealing even to local families. So they shared that it saved them time, it saved them parking costs. It was more accessible because it could work around childcare and multiple caregivers were actually attending, whereas previously we might just get one per child. And the preliminary evaluation results were also in line with that it was favorable. We were seeing similar outcomes from our in-person programming evaluation. So I'll turn it over to Dr. Gierc because she'll talk a little bit more about that and where we headed from there.
Thanks, Kiran. So yeah, as Kiran was saying, we went through this period of very, very rapid transition where digital healthcare was really brought in as a bit of a Band-Aid solution during this time of social change in order to meet the needs of our families. And what it turned out to be was a highly successful intervention that our families said that they enjoyed, that they wanted more of. And instead of closing up our virtual shop with the transition away from the acute phase of the pandemic to back to in-person, we started to ask the questions about how do we continue to utilize digital health resources on an ongoing basis, and what does this look like? So rather than just going back to straight in-person programming, what Shapedown BC has done is adopt a virtual stream. And there's been 3 major innovations that we've been pursuing over the past couple of years to make this virtual stream sustainable over the long term and something that our families really want to engage with and works for them. And those 3 changes are revising our virtual curriculum, really thinking about hybrid care, and focusing on the development of digital spaces. And that little arrow that you see connecting back to in-person, as we've returned to in-person programming, these innovations through the virtual space have been hugely influential in how we think about in-person as well, and equipping our families delivered interpersonal services, these new tools and resources that they can access as well. So our first major project was the curriculum redesign. This is ongoing to this day, and it was really meant to address some of the challenges of virtual delivery. So one of the challenges is that virtual delivery tends to be shorter. We can't replicate all in-person interactive activities. We can't bring people to the grocery store when they're virtual. We also have some limitations regarding technology. So in the traditional in-person group, typically we have a parent-only section and the kids get sent away, and we can't do this. Families might not have multiple devices. Internet really slows down when you have 2 Zoom calls on the go, issues around computer literacy, for instance. And simply because of logistics, we can't cover all the material of in-person through a virtual delivery. So what we did through the through the curriculum redesign process was really ask about how can we strengthen the program, how can we strengthen standardization, and how can we develop a virtually focused program with clear learning objectives that meet best practices right now in virtual program design. This was a collaborative process to ourselves, 6 different Shapedown BC teams. We involved patient partners, and we included the OVH educational team who are hosting this event today. It's followed a 3-phase approach, starting with a needs assessment, moving to a backward learning design process where we developed learning outcomes. And then finally, our phase that we're currently in right now is really, how do we do this? How do we have a syllabus and lesson plans and implement this day to day? It's a picture of our lovely team. They were all hybrid meetings where some people were joining in person, some people were joining virtually, and we made this possible by planning for virtual first, assuming people were virtual, and how can we develop a program and a meeting structure that suits people who are attending virtual. Backward learning design really starts with our outcomes. So we're trying to focus first on what we want learners to get out of the program. And then we think about how we're going to assess those outcomes. And from our goals and our assessment plan, we develop the lesson. So we started off with some topics. We started to develop some higher level objectives that we can meet. And then we ended up with some more specific learning outcomes that we hope our learners to get through the program and their engagement with us. This was a lengthy process. It took round numbers about 9 to 10 months to go through. This is a picture of the whiteboard process, a year of collaborative whiteboarding that we did as a group. Lengthy discussions, good discussions that really led to site-wide consensus on what we're doing and why we're doing it, which for, as we move forward with this, is going to help promote standardization so that kids across the province all get the same experience, regardless of whether they're in Fort St. John or in Vancouver. Our second big innovation is really thinking hybrid. And this started with March 2020 with the pandemic, and it is ongoing. So we have a lot of challenges to straight up virtual delivery. Families with neurodiversity, where we have kids with variable attention spans and their capacity to engage in virtual spaces. Younger children, also not a fan of sitting in front of computers for multiple hours to listen to educational content. We have the realities of needing to do medical exams and growth checks in person. And equipment for physical activity. How do we do good quality fitness programming online? We've come up with solutions during this time. So for families with neurodiversity, we're increasingly offering individual supports to these families so that they can be supported in the way that suits them best. We are providing shorter sessions for families with younger children. And for physical activity, we provide families with swag bags. So if they're joining us digitally, they get a package in the mail with all the supports and supplies they need. Medical examination and growth checks is sometimes more challenging because families, even if we're accessing them digitally, can live quite significant differences from care providers. So we've been starting to experiment with models of shared care and community visits. This is something we're continuing to work on. The last major focus has been creating a digital space, so a digital home for our program that families can connect with us through. And this is really changing the way we think about programming. One of the biggest ones is asynchronous learning. So instead of needing to come in to the hospital and have supports with us on weekdays or accessing physical activity coaches on weekends, families are able to access education, learning, resources, and supports whatever suits them best through digital portals. So one of the big ones we're using is interactive learning supports. We aren't just using Zoom rooms, so Zoom remains really the backbone of providing supports to our family. We're also increasingly using digital and collaborative whiteboarding technology, ways to sample what families are saying, get polls and feedback, in addition to trying to gamify learning so that learning isn't just something that kids find boring, but something that they find engaging and fun and turns it into applicable skills that they can use. We've been focusing on developing patient resources. One of the big ones is focusing on handouts creation that families can download as PDFs so that they're able to get sort of short snippets of information on highly specific topics versus our former workbooks, which I think, Kiran, they were about 250 pages. So much more accessible for families and very much targeted on the key pieces of information they need. And as Kiran mentioned, focusing on video development. We know kids these days are really focused on those short videos that we might see on TikTok or on Reels, 30 seconds or less. Our videos are a bit longer than that, but you can get a healthy recipe in about 2 minutes or so. We're in the process right now of collaborating with Digital Lab in creating a learning center so that families can access high quality educational and interactive material away from their facilitators. And hand in hand, we have a new program website, which is going to be arriving in spring 2024. So some final thoughts on this progress for us. Adoption of a virtual health program, we've learned, is more than just a one-to-one conversion. It's not taking a good quality in-person intervention and just turning it online and expecting it to be the same. We really do have to think about the virtual space and how families engage with us. One of the big things we've done throughout this process is really investing in relationships. We've been prioritizing relationships with the experts who have been consulting. So people like OVH, people like Digital Lab who have experience in creating online spaces, investing in relationships with our teams so that everyone has a voice at the table and can give their experience, and investing in relationships with the families that we work with so that they feel heard and respected and part of the process. Planning for more time and more resources than you always expect, as is the nature of process, and also planning for some trial and error. And last but not least, this has been a really exciting opportunity for us to bring in new innovative learning technologies and supports to capture data that helps us support families as we proceed, and really has been this amazing pivot to providing even better family-centered care in a way that families want, that is accessible to them and helps them succeed in reaching their goals. I think that's all from us. It's been a great project to work on. It's been an exciting time of change for our program, and we're really excited to see where the next couple of years go in terms of us bridging even further into the digital health realm. We're happy to take any questions.
Thank you both to Madelaine and to Kiran for a great presentation and really sharing that true journey that it takes to pivot and ensure best practices in virtual education for such a comprehensive program. That digital shift that you guys have embarked on, it's been really all encompassing, and it really shows the depth and the breadth of your intention of truly redeveloping a meaningful experience for your patients and families. So thank you. We don't currently have any questions in the Q&A, but I wonder if maybe people are typing, so I'll just hold there for a sec. But in the meantime, just wondering for yourselves as those that, what was one of the best takeaways for yourself as you embarked on the shift from in-person delivery to virtual care? What was one of your key takeaways?
This is some knowledge from one of our patient partners. I think being a healthcare provider, you focus on the evidence and you focus on the evidence base and you focus on good patient-centered care. And it's serious business providing good care. Like, we want to be good providers and we want to support families in ways that are best. And sometimes we get a little bit bogged up on the technical details and the boring sciencey medically stuff, and we forget about how important it is to have fun with families. One of our patient partners continuously brought home the point of, you need to have fun. You need to make this fun for kids. You need to make this fun for parents. You need to make this fun for families. You need to have these connections with them that is more than just the boring sciencey medically stuff, because that's how you're going to win them over, and that's how you're going to make an impact. So we, of course, want to do good quality care, but lessons in how do we do that good quality care in a way that's fun and engaging.
And the only thing I would add is, like, change at that time seemed maybe daunting, but we were able to develop so many resources or ways of doing things that, as a team across our 6 sites, collaborating together in a way that actually now has informed our in-person programming. So it's all been positive, even though it did seem quite daunting to begin with.
That's great. I just want to point out that I think John, he's in the chat, is one of the patient partners on this, and he is definitely reminding us that learning is fun and it should be. Thanks so much, John, for joining today and for your invaluable experience in this particular project. Once again, Madelaine and Kiran, thank you so much for joining us today. We will close out this session. We're trying to keep on time, a bit better this afternoon than this morning. Again, we'll put a poll up for you to give us some feedback on the session, and we'll invite you to our next session, which is entitled Connecting Patients and Providers Through the BC Provincial Attachment System, or PAS. Again, you can navigate there on the panel on the left-hand side of your feed loop screen, and we will see you there in just a moment. Thank you both.